name is Christian Willard, and I'll be telling you about the bones of your neck. The bones in your neck are known as the cervical spine. They are also commonly known as the C-spine. The C-spine contains 7 vertebrae. C1 and C2 are completely different than the rest, while C7 has a slight difference. C1 is also known as the atlas, as the cervical spine is responsible for supporting the weight of the skull. C1 is where the base of the skull and the cervical spine articulate. C2 is known as the axis, as it allows our necks to turn from left to right. As you can see behind me, C1 is completely different than the rest of them. It does not have a spinous process. The spinous process is the part of the spine that sticks out posteriorly. Posterior means towards the back. C2 has an extra process that sticks up known as the odontoid dens. This odontoid dens, along with the transatlantal ligament, holds C1 in place. This is what allows us to turn our heads. As seen here and here, the spinous process of C2 through C6 have what's called a bifid tip. That means that the spinous process, instead of coming out straight, actually cuts into a V shape. C7, however, does not. It has a typical spinous process, which is seen throughout the rest of the spine. The spinous process on C7 is also known as the vertebra prominens, which is a very common palpation landmark. We will use this example here of the C4 vertebra to discuss the rest of the anatomy of the cervical spine. The cervical spine has a unique trait of having 3 foramina. Foraminas are holes within our spine that allow the passage of arteries, veins, and nerves. The C-spine has transverse foramina, meaning that they are on the side, which allow the passage of arteries, veins, and nerves to the skull and into the brain. Another thing that you can see here is that C2 through C6 have that very prominent bifid tip. Other parts of the cervical vertebra consist of the body, which is located here, the pedicle, which is here, and it connects the body to the lateral mass, which contains both the superior articular surface and underneath the inferior articular surface. When the superior articular surface and the inferior articular surface are on top of each other, this creates the zygapophyseal joints. We also have the lamina, which is this long stretch of a bridge that connects the lateral mass to the spinous process. Behind me, I have 3 examples of images of a cervical spine. First, we have an image of a lateral C-spine X-ray image. The purpose of the lateral X-ray image is to be able to see the zygapophyseal joints in which we discussed open. Next, we have an image of a hangman's fracture. A hangman's fracture is a fracture of the C2 pedicle that also may or may not contain a subluxation of the C2 and C3. Subluxation means that it's dislocated either anteriorly or posteriorly from each other. In this example, we have the C2 sublugated anteriorly. At the bottom, we have an image of a C-arm, which contains an oblique view, an apiaxial view, and a lateral view. The oblique view is used to be able to see the intervertebral foramina open, as you can see here, which is the circles. The apiaxial view is used to see the intervertebral disc space. The lateral view, as seen above in these 2 images, is the zygapophyseal joint. These 3 images here from a C-arm in a surgical suite are used for the doctor to be able to see his correct needle placement prior to a surgery.
Now, to help me elaborate on some of the points in which I've already made today, I have my lovely assistant, Alexa, here. Now, Alexa, just turn to your side. Thank you. Now, the C7 vertebra prominens is located here. For the 3 views in which we discussed, the oblique, the apiaxial, and the lateral, you want to center at C4, which is about here, And when you're in the lateral position, you want to make sure that the patient is able to relax their shoulders low as possible, as to not obscure the view of the C7 with the shoulders. During the hangman's fracture, which we discussed earlier, this is due to hyperextension of the neck, which is most commonly seen in motor vehicle accidents. Thank you, Alexa.
You're welcome.
And so that way you can study at home, I've made a study guide in which you can practice your anatomy on your own. And if there's any further questions, you may ask at this time.